Welcome back to News Channel 20 Marketplace. I'm Ashley Doss, joined today with Dr. Craig Bax from the Center for Prevention. Thanks for joining us.
Thank you for having me.
Now, we've had you on in previous weeks, and you talked a lot about the importance of curing chronic diseases, which is something that you focus on, noticing the signs and symptoms, and really taking advantage of the resources that are available to cure these diseases, such as type 2 diabetes, as well as arterial disease. So let's go ahead and talk about some of the results that you found.
So we have a multitude of anecdotal experience, individual patients who have shown a reduction in their arterial age, a reduction in their atherosclerotic plaque burden, a reduction in visceral fat levels, improvement in their diabetes control on less medication, with dramatic improvement to the point where they even speak of cures. If you go to our website and put in a search for cure, you'll find videos of individuals who speak to that issue. I went back and I thought about our experience over the last 5 years and looked and did a search through the course of treating over 700 patients over the last 5 years with the goal of reversing and curing arterial disease, preventing heart attacks and strokes. Yeah. We've had no deaths from heart attack, stroke. We've had no strokes, one heart attack, one TIA which resulted in a carotid surgery to remove a blockage that was causing the TIA, and 2 people who have had stents in that 5-year period of time. I know that wasn't my experience with that patient population prior to instituting the program that we now implement in our practice, which is largely based on a program called the Bale-Donine method, but also incorporates elements of low glycemic diet and intermittent fasting and exercise with intensity, as well as evidence-based pharmacologic interventions and supplements. But I know that this program works now that I've been doing it for 5 years, and our patients are doing very, very well.
So what do you think were some of the key factors before coming in to meet with you to start this program that was really contributing towards their chronic diseases?
It's the environment that we live in, particularly the food environment.
Okay.
We have so much processed and highly glycemic, sugary food that we snack on and graze on an ongoing basis. That's not how we're meant to live. Our bodies are intended to survive in an environment of scarcity, and we have to recreate that to a large extent with how we eat. We're less active, we sit. Sugar and sitting fundamentally are what cause chronic disease if you really get right down to it. And if we address those problems, we'll make a lot of stride in improving the outcomes. But there also is a role for supplements and medication that help to complement that on a case-by-case basis. Another key is that our program is very personalized. We individualize the care, including to the point of understanding a patient's genetics and how that might influence how they respond to medications. One medication might be a very effective intervention for one person with one genetic makeup, but it might actually be ineffective or even harmful to somebody with a different genetic makeup. So those are things that it's helpful to know that, and things that I didn't know until 5 years ago. And I've learned since then, and I think are responsible for the outcomes that we're getting.
Okay, and lastly, if our viewers that are watching right now, they're experiencing some of these chronic diseases right now, they need assistance, they want to enroll in your program to see these results that you're speaking of, where can they go for more information?
They can go to my website, thecenterforprevention.com/HHS, and fill out the form there, and somebody from our office will contact them. Or if they prefer, just call 217-321-1987. And we'll take care of them.
All right. Thank you so much, Dr. Bax, for joining us here on News Channel 20 Marketplace.
Thank you.